my name is Laura from Aswegen. I'm a registered dietitian working in South Africa. Today I will be talking about some dietary guidelines to help manage and prevent macrovascular complications in diabetes. What are macrovascular complications in diabetes? These include stroke, heart attack, and foot or limb damage. Diabetes patients are generally at an increased risk for stroke, heart attack, and limb or foot damage due to increased prevalence for high blood pressure, increased blood clot formation in the blood vessels, and cholesterol, which actually blocks the arteries and blood flow to certain areas of the body. So how does diabetes actually cause these complications? High blood sugar levels that go uncontrolled actually damage blood vessels and the nerves around them, and then this actually affects certain functions within the body. Health goals are pretty important to help prevent macrovascular complications, particularly in diabetes. So if we look at your blood glucose target, your HbA1c should be less than 7%. HbA1c is a blood glucose value that actually indicates to us what the blood glucose has been over the past 3 months. Your blood pressure should be less than or equal to 140/80. And then if we have a look at your cholesterol values, cholesterol is made up of different components, namely your LDL cholesterol. Your LDL cholesterol is what we consider your bad cholesterol, so we do need it in the body, but if in excess it does become dangerous. We should aim for an LDL cholesterol of less than 2.6. Then we've got our triglycerides. Triglycerides should be less than 1.7. These are also considered slightly more dangerous fats if they are high. Then we've got our HDL cholesterol, which is our better fat and more protective fat, which should be 1 or more for men, and then 1.2 or more for women. And then lastly, maintaining or achieving a healthy body weight helps for blood glucose control and then macrovascular complication prevention. Targets must be individualized. So what I previously mentioned is sort of a general guideline, but we need to look at individualizing the target for the diabetes patient. This is quite a nice way of practicing portion control, the diabetes or portion plate. So typically what we want to have is half of our plate being made up of your low carbohydrate vegetables or low starch vegetables. A quarter of your plate being made up of grains, breads, rice, those types of things, your high starch vegetables, and because they typically have an increased effect on blood glucose levels, and therefore we want to consume them in moderation. And then lastly, a quarter of your plate being made up of your high protein foods. They need to be lean protein foods, so low in fat or removing any visible fat. So foods to help improve cardiovascular and heart health. We're going to have a look at that now. Vegetables. Vegetables are actually a great source of fiber, and fiber is actually linked to better or cleaner blood vessels. So particularly your low carbohydrate vegetables for your diabetes patients, because your high carbohydrate vegetables do have quite an effect on the blood glucose level. So including more of your low carbohydrate vegetables into the diet. Okay, so just being mindful of your high carbohydrate vegetables and that plate model that we had a look on the previous slide. Then fruit is a very good source of antioxidants and fiber, but must be consumed in moderation. So the benefits are there, but they do have an increased effect on your blood glucose levels. So the guideline is 1 to 2 fruits per day, because they are a good source of fiber, but we want to restrict them so that we don't have blood glucose spikes. You want to be careful for fruit juice. Fruit juice is very concentrated sugar. The one time we can, as a diabetic, consume fruit juice is when you've got low blood sugar levels. And then high fiber foods, so we have spoken about fruits and vegetables. There are actually a whole group of other high fiber foods. The benefit that high fiber foods have on macrovascular disease and the prevention or management thereof is that they actually help to clean the blood vessels, and they actually help to aid in weight loss because they actually help with blood glucose control. The release of sugar of these foods is a lot slower. They help to then improve your blood glucose levels. And then some examples of these foods would be your high fiber or whole grain breads, rice, potato with the skin on. It's considered high fiber as compared to your potato alone. And then your legumes, seeds, nuts, and as previously mentioned, your fruits and vegetables. Then minerals. There's certain minerals that are actually very important for cardiovascular protection or macrovascular protection. These will include calcium and vitamin D. Calcium and vitamin D actually help to improve cholesterol levels, blood pressure, and lower the absorption of fat into the body, which then will actually aim for improved weight loss and then cholesterol levels in the body. So food sources of calcium and vitamin D. Our calcium food sources include your dairy products, so milk, cheese, eggs are also on that list, and then your green leafy vegetables. A lot of your calcium and vitamin D rich foods do overlap, as you can see with the eggs and the dairy. And then the other vitamin D rich foods are your oily fish, such as salmon and pilchards and sardines and tuna. Another source of vitamin D, depending on where you stay in the world, is for free, is sunshine. So getting daily exposure to the sun is important. Other minerals which actually also help to benefit macrovascular complication prevention. These also help for blood pressure control. Potassium is one of them. So if we have a look at your sources of potassium, you just want to be mindful that a lot of them are high in carbohydrate. So you want to practice portion control with them. And then there are also protein sources of these high potassium foods which can be included in the diet. And then your magnesium. Magnesium food sources, your nuts such as almonds and cashews, and then avocado, pear, and spinach are also very good sources of magnesium. And then your phosphorus. You'll see some of your phosphorus foods do overlap with your magnesium foods, such as your almonds. Dietary fats should be consumed cautiously, whether they are good or bad fats. Of course, we want to include more of the good fats in the diet, and I will go into more detail about that shortly. Our dangerous fats, or the fats that we need to be cautioned on, are your saturated fats and then your trans fats. These fats actually increase your LDL cholesterol. So as previously mentioned, your LDL cholesterol, if in excess, does become dangerous and leads to stroke and heart attack and foot and limb damage. So we want to consume these fats in moderation, as they cause blocked arteries. Examples of saturated and trans fats. So your saturated fats generally come from animal food sources. So meat, chicken, and pork. And then generally their byproducts, so dairy products, butter, lard, we want to be careful for and use in moderation. Oily fish, and fish is exceptional to this. They are actually higher in unsaturated fats as compared to these foods that are high in saturated fats. Then our trans fats typically come from convenience foods or baked foods, so you want to be careful for these foods, as they also increase your triglyceride and LDL cholesterol levels. We also, however, have your beneficial dietary fats. So we want to consume more of those instead of your saturated and trans fats. These fats are called unsaturated fat. They typically come from plant sources of fat, but as I have mentioned, your oily fish is also a very good source of unsaturated fats. They help to improve your protective fat, your LDL cholesterol, so the good fats in the body, and they help to lower your bad cholesterol in the body. So they've also actually got a beneficial effect in terms of insulin and glucose control. Some examples of these fats. Most of us know about your omega-3, 6, and 9. Other words or other names for these fats are your monounsaturated fatty acids. These are our omega-9 fats. And then your omega-3 and 6 fats are your polyunsaturated fatty acids. So you can always go look on your food label for these words, and then you'll know what you're actually getting from your product. Also be mindful, omega-3 fatty acids are great source of anti-inflammatory fats. A lot of diabetes patients struggle with high inflammation or high inflammatory levels in the body, so it actually helps to bring down that inflammation in the body. So let's have a look at some of our examples of our omega-3, 6 and 9 fats. Our oily fish. Salmon isn't the only oily fish. We've also got your sardines and your pilchards. I know in South Africa it's very expensive for us to purchase salmon, so a lot of people will generally have more sardines and pilchards included in their diet as a source of omega-3. And then your plant oils, with the exception of coconut oil being a saturated fat, and avocado pear, which will also be seasonal, and then our nuts and seeds are also good sources of omega-3, 6 and 9. So how can we include more of the right type and amount of fat in the diet? We want to avoid those trans fats and use saturated fats in small amounts. We want to use more unsaturated fats, so more of your plant sources or more fish in the diet as compared to your saturated fats or your animal-based fats. We also want to be careful for hidden fats. These typically come in your food sources such as your convenient foods, takeaways, pies, those types of things. So we want to be careful for those foods. And then we want to know and understand how to read food labels. All fats should be used in moderation, even your healthier fats, because they do have high kilojoule content. So this is an example of a food label. I'm just going to highlight a few things that are quite important to consider when reading a food label. So we want to look for more low-fat foods, okay, and be careful of high saturated foods. We want to look at the lowest saturated foods, and this actually basically explains to us what we want to aim for in terms of the content per 100 grams. Low salt foods, so we're going to go into a bit more detail about salt later on, but just be mindful that salt or sodium also has an effect on blood pressure, which also then leads to macrovascular complications. And then fiber, again, as we did speak about, its effect on the keeping the blood vessels clean. We want to aim for fiber of 6 or more grams per 100 grams. It would be considered high fiber food. So to continue on how to include the right amount and type of fats in the diet, be careful for partially hydrogenated fats. So read your food labels. If you do see that in your food label, it does indicate to us that we've got more saturated fats in that product. Then consuming more oily fish, okay, at least 2 to 3 times a week. If you're unable to consume fish due to iodine, allergy, or perhaps you do not like fish, you can also include a supplement in the diet. It doesn't need to only be a fish oil supplement, it can also be a flaxseed oil, particularly if you are allergic to fish. Flaxseed oil is a good source of omega-3. Then if we look at food preparation, rather bake, grill or steam foods, using as little oil added to the meal is a great way of managing your calorie intake, and then also preventing the intake of the wrong fats. And then using more lean cuts of meat or chicken or pork, and this can be done by also removing any visible fat from those food products. Fats are important in the body. They play an important functional role. For example, in your fat-soluble vitamin absorption of A, D, E, and K vitamins. So without fats, we are not able to actually absorb these vitamins. Let's have a look at water intake and its effect on your macrovascular complications. Water actually helps the heart to pump blood more efficiently. Dehydration puts more strain on the heart, so it increases the risk for stroke and heart attack. And then caffeine, so be careful for high caffeine containing foods or drinks, because they do have a diuretic effect, which means they tend to dehydrate us. So we often need more water to consume on those days. During exercise and hot weather, you might also need more water. And then just be mindful that if you do have a cardiac condition, to consult with your healthcare professional just to make sure that fluid may be restricted in that condition. So you just want to make sure that you've got the correct guideline. So a nice general guideline for how much water is needed per day is about 8 glasses a day, or 8 250 ml glasses per day. And take into consideration again, if you're having caffeinated drinks, that you need to substitute with more water. Sodium and heart health. So sodium, or what we often know as salt, the intake of high sodium foods actually can increase the blood pressure in the body, which we don't want. It actually causes fluid retention because salt draws in fluid, and then it increases the risk of heart attacks, strokes, and then poor blood flow to the limbs, which causes that limb and foot damage. The American Heart Association suggests that we should consume less than a teaspoon of salt per day. And then if you do already present with a cardiac condition, you want to consume less than 1,500 milligrams of salt per day. So how can we actually reduce the salt in the diet to prevent macrovascular or manage macrovascular complications? So adding less salt to food, trying to avoid adding salt to foods, using herbs and spices that don't contain salt. So just be mindful of reading the ingredients list again to check if there are salt in the product. Eating less packaged and processed foods, they generally contain more salt to preserve them and increase the flavor of the product. And then eating less tin and preserved food. Again, salt is used to preserve those foods. And then lastly, again, reading food labels. So referring back to our previous slide when we had a look at food labels, we want to aim of less than 0.1 grams of sodium per 100 grams in a food product, or less than 0.3 grams per 100 grams in a food product. Plant sterols are also a great way of preventing macrovascular complications. So let's have a look at what are plant sterols. So plant sterols actually help to reduce the absorption of plaque buildup, so that's your cholesterol buildup in your blood vessels. Your daily need for plant sterols is 2 grams per day. So what does the typical 2 grams of plant sterols look like? So 425 tomatoes or 70 slices of wholemeal bread, which is a bit unrealistic, particularly for a diabetic patient who needs to restrict a lot of those high carbohydrate foods. But just to put it into perspective, these are unrealistic. But I'll give you some guides on how you can include these and reach your target of 2 grams per day. So we can actually take a supplement containing plant sterols to make up that 2 grams using sterol fortified spreads or yogurt, and then consuming foods that are high in plant sterols. So trying to combine the apples and the whole grain foods and the tomatoes in the diet in moderation, depending on your blood glucose control, with your sterol fortified foods, and perhaps the supplement actually helps us to reach that 2 grams per day goal. Okay, so there's our example of a sterol supplement, and then your high sterol foods, and then lastly your spreads or your yogurt or dairy that's been fortified with sterols, depending on what product you have available to you in your part of the world. So these guidelines are not only applicable for diabetes patients that are at risk for macrovascular complications such as stroke, heart attack, and your limb and foot damage, but also anyone that might have an increased risk or family history for these diseases. Thank you.